11 medications that are destroying your liver. Today, we embark on a clinical exploration into a critical facet of our body's physiology, the liver. Within the intricate framework of our physiological machinery, the liver emerges as a sentinel, filtering and processing substances that enter our body. Its fundamental responsibility is detoxification, a meticulous process that involves metabolizing medications, drugs, and other chemical agents. However, the misuse of these very medications, intended to alleviate ailments, can trigger a cascade of events leading to drug-induced hepatitis. The liver's unique position as the primary organ responsible for processing and eliminating chemical waste renders it susceptible to damage caused by medications. Unlike the kidneys, which possess the ability to recover from acute failure through hemodialysis, the liver lacks a comparable recourse. This makes understanding the repercussions of medication abuse on the liver paramount. Let's confront the stark reality painted by statistics. Annually in the United States, over 2,000 cases of acute liver failure and a sobering 20% survival rate without the necessity of a liver transplant for those afflicted by acute, drug-induced hepatitis. Our journey today navigates through the clinical landscape of the top 11 medications capable of instigating liver failure. But first, let's focus our lens on recognizing the early signs of liver damage. The first harbinger of liver distress is often stomach pain. As the liver swells or experiences inflammation, discomfort in the abdominal region becomes apparent. Fever follows suit, indicating an immune response triggered by liver distress. Diarrhea, though seemingly benign, can manifest as the digestive system reacts to the compromised liver functions. Nausea and vomiting emerge as consequential symptoms, reflecting the body's attempt to expel toxins that the liver, in its compromised state, struggles to process. Dark urine and white-colored stools signify disturbances in bile production and excretion, indicative of liver impairment. One of the most striking signs is jaundice, a yellowing of the skin and eyes. This occurs when bilirubin, a yellow pigment produced during the breakdown of red blood cells, accumulates in the body due to impaired liver function. It's crucial to recognize that the manifestation of these symptoms can vary in intensity and may not present simultaneously. Chew. Now, let's dissect the 11 medications that can destroy your liver. It's essential to approach this information with a nuanced perspective, recognizing that each medication's risk profile varies based on factors such as dosage, duration of use, and individual patient characteristics. Stick with us until the end of this journey. It's vital. The last medication we'll discuss holds the key to a bigger picture in responsible medication use. Medication number 1. Methotrexate. Methotrexate is a versatile medication used in the treatment of various conditions, making it a cornerstone in the medical arsenal. Its applications span rheumatoid arthritis, psoriatic arthritis, certain types of cancer, and even inflammatory bowel diseases. However, this medication comes with a caveat: the potential for liver damage. Methotrexate, in its mission to impede cell division, affects not only rapidly dividing abnormal cells, but can also impact normal, healthy cells. It is crucial for patients prescribed methotrexate to undergo regular liver function tests to detect early signs of liver damage. Medication number 2. Isotretinoin. Isotretinoin, a derivative of vitamin A, has become synonymous with a significant breakthrough in the management of severe treatment-resistant acne, particularly cystic or nodular acne. Despite its effectiveness, isotretinoin's association with liver damage underscores the need for caution. Liver enzymes play a crucial role in signaling potential liver damage, and isotretinoin has been linked to elevated levels of these enzymes in some individuals. Regular monitoring of liver function is, therefore, an integral part of isotretinoin therapy. Medication number 3, methyl-dopa. While it plays a crucial role in managing hypertension, its usage demands a nuanced understanding of potential liver-related implications. Its mechanism of action involves stimulating alpha-2 receptors in the central nervous system, leading to a reduction in sympathetic outflow and subsequently lowering blood pressure. Liver damage associated with methyl-dopa is a rare occurrence but warrants attention. The hepatic side effects may manifest as elevated liver enzymes, hepatitis, or, in extremely rare cases, fulminant hepatic failure. Medication number 4, quetiapine. Quetiapine, marketed under the brand name Seroquel, belongs to the class of atypical antipsychotics. Widely prescribed, it is employed in the management of various psychiatric disorders, including schizophrenia, bipolar disorder, and major depressive disorder. While quetiapine plays a pivotal role in psychiatric care, its association with liver damage warrants a nuanced understanding. The liver is responsible for metabolizing drugs, and quetiapine is no exception. The potential for hepatotoxicity arises from the intricate balance between therapeutic doses and the liver's capacity to process the medication. Medication number 5, risperidone. Risperidone, marketed under the brand name Risperdal, belongs to the class of atypical antipsychotics. Its versatility is evident in its applications, ranging from the management of schizophrenia and bipolar disorder to its use in treating irritability associated with autism spectrum disorders. The liver, being the primary organ for drug metabolism, is engaged in processing risperidone and its active metabolite. This metabolic process can occasionally produce reactive intermediates that may contribute to liver injury. Healthcare providers prescribing risperidone are tasked with a delicate balancing act, weighing the therapeutic benefits against potential risks to liver health. Understanding the nuances of risperidone's impact on the liver is integral, especially considering the often prolonged duration of treatment for mental health conditions. Patients on risperidone should be vigilant about reporting any symptoms indicative of liver dysfunction, such as jaundice, abdominal pain, or unusual fatigue. Medication number 6, paracetamol. Paracetamol is ubiquitous. It's a go-to medication for alleviating pain and reducing fever across the globe. While paracetamol is generally safe when used as directed, exceeding recommended doses can pose a significant threat to the liver. Unlike many other medications on this list, paracetamol-induced liver damage is often associated with deliberate or accidental overdose rather than prolonged use. The liver processes paracetamol, converting it into a compound that can be easily excreted. However, when taken in excessive amounts, the metabolic pathways become overwhelmed, leading to the production of a toxic byproduct. This toxic metabolite can inflict severe damage on liver cells, potentially culminating in acute liver failure. Adhering to recommended doses, avoiding prolonged use, and steering clear of alcohol while taking the medication are crucial precautions. Furthermore, individuals with pre-existing liver conditions should exercise heightened vigilance and consult healthcare professionals before using paracetamol. Medication number 7, diclofenac. Diclofenac, part of the non-steroidal anti-inflammatory drug family, is a medication commonly used to relieve pain and reduce inflammation. The mechanism by which diclofenac can induce liver damage is not fully understood, but it's believed to involve a complex interplay of factors, including oxidative stress and immune-mediated responses. Individuals with pre-existing liver conditions, such as cirrhosis or hepatitis, should exercise extra caution when considering diclofenac. Patients, unsuspecting and seeking relief, fall under diclofenac's spell. The initial promise of pain relief slowly transforms into a silent assault on the liver. Abdominal pain, jaundice, and unexplained fatigue, ominous whispers that something is amiss, go unnoticed until it's too late. Medication number 8, allopurinol. Our exploration into the 11 medications that can cause liver damage now leads us to allopurinol. A stalwart in the arsenal against elevated uric acid, allopurinol steps onto the stage when lifestyle modifications alone fall short in controlling conditions like gout. Patients entering the realm of allopurinol should be forewarned, not by the thunderous arrival of side effects, but by the subtler signals of liver impairment. Regular monitoring for signs of liver dysfunction becomes imperative, with a watchful eye for jaundice, dark urine, or unexplained fatigue. Medication number 9, amiodarone. Its widespread use is rooted in its remarkable efficacy, significantly improving arrhythmias, and even boasting the ability to clear 24-hour Holter records. While acute liver injury isn't a frequent outcome, the extended use of amiodarone can, in some cases, unravel into hepatic consequences. The liver, diligently metabolizing this medication, finds itself at the epicenter of potential harm. It's essential to recognize that its effects on the liver unfold over a span of weeks to months. Unlike immediate threats, this delayed manifestation demands a prolonged state of vigilance. For individuals navigating cardiac arrhythmias, the path to rhythmic stability must be threaded with awareness of the potential toll on the liver. Medication number 10, amoxicillin with clavalin. Amoxicillin with clavalin, a combination of antibiotics, is widely present in the medical landscape. While hailed for its efficacy, amoxicillin with clavalin harbors concerns, especially concerning the liver. Reports and statistics indicate that hundreds of cases of acute liver injury have been associated with the use of this antibiotic combination. Acute liver injury, a serious condition involving sudden damage to the liver, poses potential consequences if not promptly identified and addressed. Understanding the statistics surrounding amoxicillin with clavalin adds a layer of gravity to its potential impact on liver health. Regular monitoring for signs of liver damage, including jaundice, dark urine, and fatigue, becomes imperative for those undergoing treatment. Medication number 11, statins. Their mission is clear: reducing levels of low-density lipoprotein LDL cholesterol, commonly known as the bad cholesterol, to mitigate the risk of cardiovascular events. The mechanism behind statin-induced liver damage is multifaceted. Statins, as they navigate the bloodstream, may prompt an increase in liver enzymes, indicative of potential stress on the liver. Monitoring for any deviations from baseline liver enzyme levels is essential to detect early signs of liver strain. It's crucial to note that statin-induced liver damage is considered rare, and many individuals can safely incorporate these medications into their cardiovascular care plans. Thank you for joining us on this exploration of the 11 medications that can destroy your liver. Don't forget to subscribe and to share this knowledge with your loved ones. Awareness is the first line of defense against potential medication-induced liver harm. See you in the next video.